Hi, welcome to my channel. I am Neeta, Faculty of Nursing. Today, I will discuss about gallbladder disorders, 4C of gallbladder disorder, cholelithiasis, cholecystitis, choledocholithiasis and cholangitis. We all heard about cirrhosis. One important type of cirrhosis is alcoholic cirrhosis. But nowadays, non-alcoholic cirrhotic cases are increasing. Biliary cirrhosis is one of the important type of cirrhosis. It is characterized by destruction of small bile duct that drain bile from the liver and also damage of the liver cells. Its main reason is biliary disorder, obstructed stones in the bile duct. It means if there is any problem in the biliary system that affect normal functioning of liver. Same time, gallbladder and pancreas are the other two organs that also will be affected by biliary problem. These three organs are connected to the biliary tree. Biliary system is like a tree. These three organs are connected through its duct. From the gallbladder cystic duct, from the liver hepatic duct, and that connected together to form main stem of the tree, that is CBD, and that joined with pancreatic duct and enter into ampulla of Neetas. Okay, that is regarding the biliary system. Let's enter into the topic. The gallbladder disorders 4C. Cholelithiasis. It is less severe one. It is gallbladder stone. Cholecystitis. It is inflammation of gallbladder. It is more severe. Choledocholithiasis. It is much more severe. It is gallstones in the common bile duct. Cholangitis. It is inflammation of the bile duct. It is more problematic one. Acute suppurative cholangitis. It's an emergency condition that need immediate intervention by biliary drainage. So what is the first C? Cholelithiasis. It is stone formation in the gallbladder. Colicky pain is the main character. The pain can be steady pain. And this pain may come and go without causing much more trouble. But in some cases, it can move and stuck at the level of cystic duct. That leads to cholecystitis. So the main cause of cholecystitis, it is cholelithiasis. About the stones, about the gallstones. The gallstones can be cholesterol, can be pigment stone, can be mixed one. Cholesterol stone is the most common one and its color is yellow. Pigment stone, it is made up of, or its content is pigment, bile pigment, that is bilirubin and biliverdin. And it is commonly seen in hemolytic diseases like hemolytic anemia, thalassemia, sickle cell anemia, and also in cirrhosis. And there is another stone, it is calcium bilirubinate stone. It is seen in biliary tract infection. So these stones can move from the gallbladder and stuck at the level of cystic duct may lead to cholecystitis. Its main feature is Murphy sign with leukocytosis, nausea, vomiting and fever are the other features. This may travel and go and stuck at common bile duct. It is choledocholithiasis. Main feature is jaundice because of obstruction of the bile by the gallstone. Then it again come down and stuck at ampulla or pancreatic duct. Then it causes two important features, Charcot triad and Raynaud's pentad. It causes inflammation of the bile duct, that is cholangitis. This gallstone occlude at the level of cystic duct is the problem. It causes inflammation of the gallbladder, that is acute cholecystitis. It causes increased pressure within the gallbladder and gallbladder edema. It compresses the vasculature and causes ischemia, fibrosis and necrosis, perforation of gallbladder. So bile peritonitis can occur, bile stone ileus can occur. It's mainly due to the acute cholecystitis is mainly due to calculus, that is due to bile stone. It can be due to acalculus, that is due to the sepsis, burns, patients on mechanical ventilator, TPN, patients who are receiving TPN, total parenteral nutrition for long duration, make the patient risk for getting acalculous cholecystitis. We all heard about 5F, Fair, fatty, fertile, 40 female. Fair, fatty, fertile, 40 female are risk for getting cholecystitis. Obesity is a risk because of high cholesterol precipitation. Multiparous pregnant women, because of the influence of the estrogen, cholesterol precipitation will increase. Some biochemical changes will occur in the bile. That makes the women risk for getting cholecystitis. The women who are receiving estrogen therapy for long duration, age above 40 years, are also a risk factor for getting cholecystitis. Okay. So that is brief about cholecystitis, its introduction part, and about its pain, gallbladder pain. Where is its location? Its location in the right upper quadrant of abdomen. It radiates to the shoulder tip through the phrenic nerve and its innervation to the scapula and below the level of scapula. It is referred pain. Sometimes it is known as gallbladder attack. And the pain with fever, nausea, vomiting, tachycardia, and severe diaphoresis. These are the features accompanied with gallbladder pain, especially after fatty food intake. And some signs are also there. Murphy sign, Bias sign, Champagne sign. What is Murphy sign? The examiner is palpating in the right upper quadrant of abdomen. And we are instructing like what? Take a deep breath in. So what happened? The diaphragm pushed down and it compresses the gallbladder, and same time we are palpating now. So sudden step of inspiration will occur. That is a character of Murphy sign. What is Bias sign? It is hyperesthesia. It means what? Increased pain sensitivity at 10th and 12th thoracic vertebrae. That is below the scapular region, the pain is located. High sensitivity of pain is located. That is known as what? Bias sign. It is due to referred pain through phrenic nerve. What is the next sign? It is Champagne sign. It is gas bubbles in the gallbladder due to the necrotic changes in the gallbladder and emphysematous gallbladder that contain gas bubbles. That it is visible in the ultrasonography. That is known as what? Champagne sign. So that is about the cholecystitis, its important characters and pain. Then about the biliary colic. It's a familiar term. What is biliary colic? Colic, intermittent pain, colicky pain. It is due to transient blockage of the cystic duct or bile duct. This pain aggravate or seen more commonly after meals. Okay. And next is regarding cholangitis, is the most severe form of 4C. The last C, that is choledocholithiasis with infection, is known as what? Cholangitis. Two important features you have to note, that is Charcot triad and Raynaud's pendant. That is mainly due to the bile duct inflammation and obstruction of the bile flow. Its backflow to liver occur. And so main feature is what? The jaundice. That is fever, right upper quadrant pain, jaundice. Three features together, Charcot triad. Then two additional features, that is Charcot triad with altered mental status, hypertension, Raynaud's pendant. It's an emergency, need immediate biliary drainage. So that is about my topic discussion. Now we can go to the details of some questions. The questions are very important. All should go through the questions. What is the reason for referred pain in cholecystitis? That is the radiating pain through phrenic nerve and its branches is the reason. Phrenic nerve, it is a bilateral mixed nerve. Parasympathetic innervation to gallbladder by vagus nerve. Another question, what is the most common type of gallstone? Cholesterol stone. What is the common color of cholesterol stone? Yellow. What is the color of pigment stone? Brown or black. Biliary colic is characterized by right upper quadrant pain. Pain in cholecystitis is aggravated by food intake, that is after fatty meal. Charcot triad is characterized by jaundice, fever, right upper quadrant pain. A scenario, a client admitted to the hospital with complaints of upper abdominal pain, nausea, vomiting for several times. Diagnosed as cholecystitis. What is the nurse's action? First nurse's action. Manage pain. That is the first concern. There are many other concerns, but our first concern goes to manage pain. In which disease condition Charcot triad is seen? Cholangitis. Raynaud's pendant is seen in acute suppurative cholangitis. Murphy sign is characterized by sudden onset of pain in the right upper quadrant with sudden struck of inspiration during palpation on right upper quadrant by the examiner. Another question. Raynaud's pendant is characterized by fever, jaundice, right upper quadrant pain, altered mental status, hypotension. Okay, this is brief about my class. If you like, please subscribe. Thank you.